You may be wondering what adenomyosis is. Adenomyosis is a gynecologic condition which is a thickening of the junctional zone of a woman's uterus. The junctional zone is that area right beneath the lining called the subendometrium. The lining is called the endometrium, so it's a thickening of the area just beneath the lining. Technically, any woman that has this area thickened to greater than 12 millimeters has adenomyosis. Pathologically, it's these cells from the lining plunging deeper into the area beneath the lining, the subendometrium, or even the muscle of the uterus called the myometrium. The more these cells penetrate deeper into the uterus, the thicker the junctional zone is. If you're experiencing symptoms of heavy bleeding and pelvic pain, you may have adenomyosis. Adenomyosis will present itself as either pain during the menstrual or very heavy periods during the menstrual, very similar to the patients that present with fibroid tumors. The difference between the two is, in general, women that are suffering with fibroid tumors, the bleeding is the more significant component of those two symptoms. Whereas in adenomyosis patients, in general, the pain is the most significant symptom. So both patients have heavy periods and pelvic pain. Adenomyosis patients, the pain is the more significant in general, and in fibroids, the bleeding is more significant symptom of the two in general. The treatment options for adenomyosis are the following. Usually when women present with adenomyosis, because the pain is the more significant symptom, the first line of treatment is usually non-steroidal anti-inflammatory medication like ibuprofen or Motrin. Unfortunately, most of these times, patients that are treated with these non-steroidal anti-inflammatory medications, it's not enough. It may help with the pain, but it doesn't treat the underlying condition. The next thing that is often tried is a IUD, a Mirena, a levonorgestrel hormone-releasing IUD. Again, these IUDs can be helpful for some patients, but in general, it's not going to be enough. And there are two things that are enough. You could undergo surgery. Unfortunately, there's no way to cut out the adenomyosis. It's a very diffuse process. This thickening of the junctional zone makes it such that there are no discrete boundaries. So they can't surgically cut out the adenomyosis like they can with a fibroid. So the only surgical option available for these women is to undergo a hysterectomy. Now, fortunately, there is another option, a non-surgical option called uterine artery embolization. It is the same procedure that is performed for fibroids, the uterine fibroid embolization procedure. So UAE and UFE are the same procedure. Obviously, if you don't have any fibroids and you just have adenomyosis, it's called UAE. But some women actually have both. And so the procedure is the same, the approach is the same, the technique is the same. It's just can be used for both adenomyosis and fibroids.